you?
Good. How have you been?
I've been good, except for I've been having some lower back pain, which is why I'm here.
Okay, so Sarah is a firefighter. She's legit, and she's been having some pain in the back. So tell me about like what it feels like. Where are you feeling the pain?
So I have a lot of pain just in my lower back, starting kind of in the middle and going out, but it doesn't really go too high.
Okay, so it's kind of off the SI joint. It's kind of in the glute medius area, that area. So if it was higher, I would kind of suspect something like the QLs, like quadratus lumborum, or something just off the erector spinae. But sometimes when you have pain down there, sometimes it's your glutes that's the problem, and then sometimes it's the front of your body, like your psoas, your quads. So we're gonna do a couple tests and kind of see what I think might be the problem. Okay, so much of the time, a lot of the pain comes from the front, and I'll explain that. But I want to test to see if that's where it is. So this is a really good test to do for the psoas. So go ahead and relax. Okay, so now what I'm wondering is if you start to feel the stretch in your back, in your lower back.
Yes.
You're feeling it already?
Yes.
Okay.
I'm very tight.
Okay. So that kind of indicates that a lot of your pain is coming from the front. And so we're gonna do some work on your quads and on your psoas and get that stretched out so that can relax, so your nerve can relax. All right, I wanted to show you the type of massage that I would give to someone like Sarah with this type of back pain. When I work lower back pain, I usually do start on the actual back muscles. Even if they aren't the main cause, it just helps the client to relax, knowing that you're there taking care of their pain spots. And this can help the nervous system to relax, which will reduce the pain. I'm going to spend some time pushing erector spinae and some of the lower back muscles away from her spine. This is one of my favorite ways to do this, and it can help free up the nerves that can be constricted. Then I'm going to focus on adhesions that I feel in the thoracolumbar fascia, and I'll spend time stretching and holding those individual spots, just really trying to release the fibers and get that area to not be so constricted. Now that the overlying fascia is nice and loose, I'm going to start reaching into that QL or the quadratus lumborum. Now if you have a job that requires you to bend over a lot, or if you lift a lot, this one is probably pretty tight on you. Sometimes I like to use my fingers to stretch out the different fibers of the QL, and sometimes I'll use my elbow to get in there deeper, just really access those fascial adhesions. These are the ones that keep the different muscles that intersect there pulled tight and unable to stretch. Now a lower back massage and glute work should almost always go hand in hand. Even if the front of the body is pulling, the glute medius can act like an angry mistress and hold that nerve off of the SI joint hostage. It can be so bad that your whole back freezes up and can really be quite painful. I like to use a little bit of cross-friction right off of that SI joint here to help free up the fascia around the nerve and greatly reduce pain right away. Now it must be noted that back pain can be tricky, and sometimes working around the nerve can cause irritation. It needs the release, but it's just good to remember that it's normal if it flares up a little bit during massage. Now normally for lower back pain I will do a lot more of glute work, but I will save that for another video because this doesn't happen to be Sarah's problem. Next, I'm going to flip Sarah over and work her quad. Now my goal with her is to free up those lateral and medial quad muscles, as well as to use Gua Sha to help release the entire muscle.
Tight medial thigh muscles absolutely can be the cause of SI joint problems and even can lead to sciatica. Those of us that sit too much or work out a lot and then sit tend to have shortened medial muscles, which then pull the hips tight and also shorten the psoas, which we will get to in a minute. After I warmed Sarah's medial muscles, I did use my forearm and elbow here. I do this quite often, but you really have to use lighter pressure because these muscles are sensitive. This style of deep tissue isn't fancy looking, but it works and it takes patience. Sarah's inner thighs feel stringy and ropey and they feel stuck right there in the middle. The sartorius in particular is one that I want to address with her, and you probably will too. I spent a lot of time here, but I'm only going to show you a little bit of this work. Now the quad is nice and warm, and it's time to do some Gua Sha on it to help release the fascia everywhere. Now this is one step that probably helps the most. I can either spend hours massaging, waiting for the fascia to release, or I can shorten the time spent with my tool and Gua Sha to get better results. I have lots of Gua Sha videos if you want to find out how to do this, or you can find one of these tools in the description below, but y'all know I love this thing. Now that the hips and thighs are looser, I'm going to include this great table tie stretch. This is one you can do to compare at the beginning and at the end where their flexibility is at. Now comes the fun part. We determined that Sarah's psoas was shortened and needed to be released. So we're going to do some work in her belly. I always start with some softer work before digging in deep here. But the psoas is a stomach muscle that actually wants to be a back muscle. You have to access it through the front of the body, and it attaches to the spine and the inner thigh. Now when this muscle gets shortened, your back will tell you about it. We go back to talking about sitting a lot. This one will be the one that suffers the most. The active release methods that I use are really effective. Lifting the knee while pressing down on that muscle will help me to find Sarah's psoas where it's at as it contracts. And then as Sarah lowers her leg and turns her foot while I'm pinning it, it can help that muscle to release. I do this off of the belly button as well as the hip portion of the muscle. If when you press on it, they feel it in their back, it's a sure sign that it's part of their problem. Now it must be noted that I don't normally do psoas work on the opposite side like I'm showing. I'm just doing that for purposes of filming, but I will also add some fascial stretch and trigger point release with that hip turned out right on the iliacus. The hip bone is open and you can really get in there and release some of those tight hip muscles. The motion I use looks like I'm trying to pry open a window or something like that. By the end of this massage, Sarah was feeling much better. I made sure to do some of those quad stretches and hip stretches again before she left, but go give it a try.